might start with that point. So this is about the change in the booster program advice from ATAGI, but a real call out to anyone in Australia who is currently eligible for their primary doses, those first 2 doses, that this is still the most important component of protection. We've seen a rise in intensive care patients in New South Wales in recent days. Almost all of those have been unvaccinated, not even a first dose, let alone a booster. So that still remains the number one priority for the vaccination program. The changes today, as announced by the Minister on the basis of the ATAGI advice, I just would like to also join my voice to the Minister for thanking ATAGI for their work over the last week and indeed right throughout this process. It is very difficult making decisions as evidence is coming forward on a daily or even hourly basis. It is 4 weeks today since we found out about Omicron, this new variant of concern. And in those 4 weeks, we have already gained a lot of information, and in the recent days, even more information, particularly around severity and what is the effectiveness of vaccination programs around the world. So why has this announcement been made? There's 2 reasons to bring forward the booster dosing. The first one is as has been mentioned by the Minister, as has always been our main aim of the program, is to protect those that are most at risk of severe disease. So they remain our priority. Protecting people against severe disease remains our priority. The information we know, and as I say, it's been emerging only over the last few weeks about the protection of the vaccine. We know 2 key things. One is that there is a diminished but not completely, the protection does not completely disappear in relation to severe disease from the first 2 doses of the vaccine. It wanes over time, hence the time-based change in the boosters. The positive effect of that is that we do know now that boosters do protect and increase that protection against severe disease once that 3rd dose is given, or a 4th dose in the case of immunocompromised people. So though that they are given, it's an absolute aim of the program to go forward and do that. But I will stress that just because you get to 3 months or 4 months or 5 months or 6 months, it doesn't mean that you immediately just that day lose your protection. That is not the case. It does decrease over time. It remains in place for severe infection, but it is diminished for Omicron compared with Delta. So that's the first point of the reason why we're bringing forward that booster program to 4 months from the 4th of January and 3 months later towards the end of January. The second reason is because boosters at this stage can help about the transmission of the virus, so the infection of people and with mostly mild or even asymptomatic disease, but they can then transmit it to other people. We know that, unfortunately, 2 doses does not change that ability to become infected a great deal. That, again, wanes over time, and there is a time-based process to that. But that protection against infection is diminished again in Omicron. That's quite clear. Again, with a booster, it goes back towards the same levels as Delta. It will be an important and is already becoming an important part of our control of the current Omicron wave in Australia. It is not enough by itself. The public health and social measures that have been introduced in many states in the last few days will assist with that as well. The personal protective elements that we all know so well. You would have noticed at the beginning of this press conference, both the Minister and I were wearing masks. I'm wearing a mask wherever I'm indoors in a public setting, and wherever I cannot guarantee to be socially distanced. So that is an important component, and we've seen that change in recent days. The final thing I would say, just to stress a couple of the small print details within the ATAGI advice, and this really goes to the heart of protecting the most vulnerable first. So we really do encourage people to come forward if they are in those well-known vulnerable groups for severe infection. People who are our elders in the population, Aboriginal and Torres Strait Islander people, those with chronic disease, those who are immunocompromised. You now can get that 4th dose. That will be your booster if you are eligible with that 4-month interval going to 3 months later in the month. And I just a real shout out to anyone who is pregnant or is planning to be pregnant. These vaccines are very safe in pregnancy. We know now very clearly that both the woman who is pregnant and their unborn child, they are both at risk from this virus, and vaccine does protect and is safe. So that is very important for anyone who has not yet had their primary dose schedule or are eligible for a booster. Please do not hesitate just because you are in those categories.